Today I'll be talking on the sample collection of skin, nail and hair. So before the collection of the skin, hair and nail, I'll just give a brief intro. Firstly, you have to clean the area with 70% alcohol, as this minimizes contamination and it also helps to in the microscopy. If greasy ointment or powder have been applied, then skin scraping, nail clipping and small hair pieces should be taken and placed in a sterile container and sent to the laboratory as soon as possible. Sample can be stored at room temperature before transportation. So to begin the fungal culture collection, I'll first start with the skin sample. It is a very simple method. So firstly, you have to cleanse the skin with 70% alcohol. Then collect the epidermal scales with a scalpel at the active border of the lesion. Then place the specimen in a dry, sterile container and transport immediately to the laboratory at room temperature. So that is how the skin samples are collected. Now moving on to the nails. Cleanse the nail with 70% alcohol and remove the outermost layer by scraping with a scalpel. Clipping from any discolored or brittle parts of the nail may be used. Then the deeper scraping and the deeper scraping and debris under the edge of the nails are they are also used. So place the specimen in a dry sterile container and transport immediately to the laboratory at room temperature. So this is how we collect for the nails sample. Now moving on to the scalp and hair. You have to scrape the scalp with a blunt scalpel. Remember, the blunt one, not the sharp one. Then collect the basal portion of the infected hair. Then place the hair in a dry sterile container. However, in case of the hair sample, it should include the hair roots, as hair cuts with a scissor is unsatisfactory and not recommended, as the focus of infection is usually below or near the surface of the scalp. So and then transport to the laboratory at room temperature. Also remember that it is ideal that the hair sample is collected before any treatment, including the dyes, bleaching, hair creams, oil, etc. It is also important that the hair should be washed 24 hours prior to sampling and dries for at least 4 hours. So in general, all the specimen, that is the hair, skin and the nails, is either treated with 10% KOH or stained with a special fungal stain. Use of 10% KOH dissolve the tissue material, leaving the alkali resistant fungi intact. So calcofluor dye is a fluorescent dye that combines with fungal cell wall, and it is very useful in identification of fungi in tissue specimen. So moving on to the transport of this specimen. Specimen must be transported and proceed within 2 hours of collection preferably, and specimen collected from the site like the skin, hair and nails may contain a mixture of rapidly growing bacteria or other saprophytic fungi apart from the slower growing pathogenic fungi. So to reduce the overgrowth of commensal or in condition where a delay in the transportation of specimen is expected, you have to penicillin, streptomycin, chlorophyll, maybe it can be added to the specimen. So and also in any case of delay, the specimen may also be stored under refrigerator at 4 degrees centigrade for no longer than 24 hours, as some loss of viability may occur. So this specimen that is dermatologic specimen, they are usually kept at 15 to 30 degrees centigrade. In short, there is always a possibility of recovering a fungal isolate in spite of some delay, especially if steps are taken for proper collection and transport. So the specimen can be transported in aerobic media. In anaerobic media, specimens like the hair, the skin scraping can be directly inoculated on the onto the appropriate media immediately after the collection. This is immediately after the collection for the optimum recovery of the fungi. So And the method of this specimen collection for the diagnosis of superficial and deep cutaneous mycosis should be like it should be regularly employed in daily clinical practice so as to achieve high diagnostic accuracy that will ultimately help in the effective and timely treatment of this disorder. Also, like separate section of paperwork should be maintained while transporting, and also biohazard label should be pasted. So this is all about the collection and processing of the hair, nail and skin sample.